So in this MRI, we are going to learn how to report an infarct. So first, I will be showing you diffusion weighted images, which is this side, and ADC maps. On this, we can see areas of restricted diffusion. And we can see that there are patchy areas of restricted diffusion in the periventricular, deep, and subcortical white matter with corresponding low signal on ADC maps. There is also restricted diffusion in the caudate nucleus, the lentiform nucleus, and some part of the internal capsule. So we can also see a foci here in the region of the left hippocampus, parahippocampal region. Now, the next thing to compare in an acute infarct will be flare images, because that's gonna decide whether it was acute, hyperacute, or otherwise. So we're gonna take the T2 flare images, and in the T2 flare images we can see that those areas are hyper intense, which shows that it's an acute infarct. And not in a hyperacute infarct. And we can also see some ill-defined foci of hyperintensities which were not seen in the restricted diffusion in the diffusion weighted images. Thus, these are chronic lacunar infarcts or chronic small vessel ischemic lesions. There are many names to the same thing. We should try to see whether it's involving the corpus callosum, because then the differential of demyelinating disorders like multiple sclerosis also comes into play. We can also see that there is a foci or a focus of hypointensity, most likely an old lacunar infarct. Let's see, on the corpus callosum looks fine. So those are small vessel ischemic lesion, and yes, they were lacunar infarcts, which are they're now encephalomyelitic areas in this region, or because of eventual gliosis of the old lacunar infarcts. So those are the findings, and we should look at the GRE images to see whether there's any bleed associated, because if there's a bleed, it has to be reported as acute, it has to be reported as hemorrhagic transformation of the infarct, because that's very important, because in an infarct they will be giving some streptokinase or some decoagulators, and if there's a hemorrhagic infarct, it's a contraindication, because that will just increase the bleed. So it's very important to determine whether an infarct is hemorrhagic or non-hemorrhagic. Here we see that it's a non-hemorrhagic. There are absolutely no areas of blooming, and so it's a non-hemorrhagic acute infarct in the so we'll report it as acute infarct in the left gangliocapsular region, left frontoparietal periventricular deep wide matter, and left parietal subcortical wide matter. Restricted diffusion is seen in this region. It appears hyperintense on flare images. No blooming is seen. This much is important for this much is a complete description of an infarct, and this much has to be given in every infarct case. And then we talk about the chronic lacunar infarcts in the bilateral periventricular and deep wide matter. Then we say the rest of those things are normal, and the impression will be an acute infarct in the same places as we described above. Sometimes people give it as acute infarct in the left MCA territory to make it look different from the description above. It's a choice which you can use, and then the rest will be chronic infarcts and small vessel ischemic lesion, bilateral periventricular white matter. Sometimes people here describe it as ill-defined flare, hyperintensities, showing no blooming or restricted diffusion. Those are just play of words. You can use any of them. That's up to you. That will complete the entire report. Thank you.